Good afternoon. My name is Serge. I'm the student nurse practitioner, and I will be performing a head, eye, ear, nose, throat, and respiratory examination. Okay. So I sanitize my hands. Tell me your name and date of birth, please. Your ANO times. What is your date of birth?
I think we should start over.
All right. 1, 8.
I just forgot my date of birth.
All right. 1, 2, 3. Hi, good afternoon. My name is Serge. I'm your student nurse practitioner today. I'm performing a head, eye, ear, nose, throat, and respiratory examination. So I'm going to start off by sanitizing my hands. All right. Can you just confirm your name and date of birth for me?
Yes, Renata Yapasova, June 6, 1994.
Okay, very good, very good. So I am going to begin by performing a head examination. Okay, so I'm going to inspect your skull, noting your size and contour. Okay, so contour appears to be round, no evidence of depressions or bumps. Okay, very good. No scales or lesions are visible. All right, so palpate your scalp for any tenderness, all right, or any bumps or masses. Any pain at all anywhere? Okay, very good. Hair is fine and smooth. Okay, so let me inspect your face for symmetry. Okay, face is symmetrical, no signs of any drooping. Okay, there's no lesions, bumps, rashes, ulcers, or discolorations apparent on your face on visual examinations. Okay, very good. So inspect your, palpate your temporal artery for pulsation. Okay, so your temporal artery is 2+ in pulsation. All right. So what I'm going to do next is I'm going to perform a Rosenbaum eye examination. Okay, so I'm going to give you a Rosenbaum chart. Just hold that 14 inches from your face. Close your right eye for me. Okay, and read the smallest line that you can read for me, please.
937E20.
Okay, very good. Now read the smallest line with your right eye.
937E20.
Okay, now open both eyes and read the smallest line that you can read.
937E20.
Very good. So your vision is 20/20 from this examination. All right, very good. So what I'm going to do next, I'm going to inspect your external eyes. Okay, so I'm going to inspect your eyebrows. Eyebrows are equal bilaterally, no signs of drooping or infected hair follicles. Very good. So I'm going to inspect your eyelids. Just close your eyes for me. Okay, no redness, swelling, or discharge is visible. Okay, so just look straight ahead for me. Eyes are equal bilaterally, no signs of any redness or discoloration. Okay, so your eyes are positioned equal bilaterally. Okay, so inspect your medial, lateral canvas next. So I'm just going to pull down on your lower eyelid. Okay. All right. No redness, swelling present. Your lacrimal system also doesn't have any dryness or excessive discharge. Very good. So just let me inspect your sclera. Okay, so sclera is white. Very good. So your cornea doesn't have any visible abrasions, which is good. Your iris appears to be brown in color, equal in size bilaterally. Okay, and your pupils are equal bilaterally, size 2 millimeters each. Very good. So what I'm going to do next is I'm going to inspect your pupils for direct and consensual pupillary light reflex. So I'm going to shine the light into your right eye. Direct pupillary reflex present. Now I'm going to inspect your consensual reflex. Okay, so it's also present. Inspect your left eye. Okay. Direct light reflex is present in your left eye, and your consensual reflex is visible in your right eye. The light in the left. Very good. So what I'm going to do next is I'm going to perform a test for convergence and accommodation. Okay. So I want you to look at this pen. All right. So just keep focusing on it, keep looking at it. Okay. Your eyes are converging and your pupils are accommodating equally bilaterally. Very good. So what I'm going to do next is I'm going to perform a confrontation test to inspect your visual fields. Okay. So what you're going to do for me is you're going to close your right eye. Okay. How many fingers am I holding up?
2.
How many fingers?
1.
Okay. Close your left eye.
2. 1.
Okay. Very good. So your eyes have good confrontation in both eyes. Very good. So I'm going to perform a test to see if there's any extraocular movements. So just follow my finger and then move it in an H pattern. Okay. Okay, very good. No extraocular movements or nystagmus is present. So what I'm going to do now is I'm going to perform a fundoscopic exam on your eye. Okay. All right. So I'm going to look straight ahead. All right. So on the fundoscopic exam, I see a red light reflex is present. There's no opacities. No sign of any hemorrhaging, your macula is clear, there's no AV nicking, and your disc ratio is 0.3. Let me check your left eye. Okay, so your left eye, disc ratio again is 0.3, no AV nicking, macula is clear, no sign of hemorrhaging, and no opacities are present. And your red reflex is also present in your left eye as well. So next, what I'm going to do is I am going to inspect your nose and your sinuses. So I'm going to palpate your maxillary sinus. Any pain?
Nope.
Okay, your sinus, any pain? Okay, very good. So there's no tenderness in your sinuses. So you palpate your nose to see if there's any tenderness. Any tenderness in your nose?
No.
Okay, very good. So what I'm gonna do is I'm gonna inspect your nasal cavities, okay? Great. So I'm gonna inspect your right nostril first. Okay, your septum appears to be midline, no perforation, no redness or discharge. It is pink and moist. I'm gonna inspect your left nostril. Okay, left nostril also pink and moist, no redness, perforations. Your septum is midline. Okay, very good. So what I'm going to do next is I'm going to palpate your. So I palpate your nose. Next, I'm going to examine your mouth. So your lips appear to be pink, moist, no cracks, no ulcers, no signs of cyanosis. Very good. So what I'm going to do is inspect the inside of your mouth. Okay. So just stick out your tongue for me. So tonsils are +1 bilaterally. No sign of any redness, discharge, tonsil stones. All right. Just lift up your tongue for me. Okay, very good. No signs of cyanosis. No redness, ulcers in your buccal mucosa. Your dentition is intact. No missing teeth. Very good. Okay. So your palates were moist, no evidence of depressions or bumps, no exudates in the tonsils. Okay. So next, I'm going to inspect your ear. Okay. So I'm going to perform a whisper test. So just close your eyes for me and tell me what I'm saying. Okay. 82.
82.
All right. Very good. So no issues with the whisper test. I'm going to perform a Weber and a Rhine test. The test for sensory neural or conductive hearing loss. I'm just going to perform the Weber test, so I want you to tell me which side, which ear you hear the sound the loudest on.
Same.
Okay, very good. So no evidence of any conductive hearing loss. So I'm going to put it on your master processor for the Rhine test. Tell me when you stop hearing the sound.
That's it?
Okay, you hear the sound now?
Yes.
Okay. Air conduction is greater than bone in your right ear. Same thing. I'm going to place it on your master processor. Tell me when you stop hearing the sound.
That's it?
Okay, can you hear the sound now?
Yes.
Okay, so ear conduction is greater than bone conduction on the left ear as well. So there's no evidence of sensory neural or conductive hearing loss. So your auricles appear to be equal bilaterally. No signs of any redness or inflammation in both ears, which is good. So there's no visible nodules as well. So I'm going to palpate the master process and tell me if there's any tenderness, okay? No tenderness at all?
No.
Okay, very good. So what I'm going to do next is I'm going to perform an exam on your the inside of your ear. Okay. So I'm going to fold your pin up and back. Form of white is present at 5 o'clock. Tympanic membrane is pearly gray. No perforations, redness, or discharge visible. Okay, on the left ear, I'm going to pull up and back. No perforations present. No redness, swelling, discharge. Pearly gray tympanic membrane. Cone of white at 5 o'clock. Very good. So there's no evidence of any lesions or infections on examination. So your cerumen is yellow in color, which is normal. Next, I'm going to perform a neck examination. So I'm going to assess your neck for any masses in the palpate. Okay. Any tenderness present?
No.
Okay, very good. So I'm going to palpate for your lymph node chains. So I'm going to start off with your preauricular. Okay. Check your post-auricular, your occipital, okay. Tonsillar, submandibular, submental, superficial cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular. Okay, so lymph nodes, there's no swollen lymph nodes are present. So I'm going to palpate your trachea. If there's any deviation, trachea appears to be midline, which is normal. Palpate for your thyroid. Okay. So for your thyroid, your isthmus is midline, which is normal. Your lateral lobes are equal bilaterally. So it is symmetrical, and no nodules are present. Any tenderness?
No.
Okay, very good. So next, I'm going to perform a chest examination. So I'm going to have you dressed for preserve your modesty. Okay, so I have a gown on you. So I'm going to check your AP diameter. So your AP line diameter. So do me a favor, stick your arms out to the side. AP diameter is 1 to 2, which is normal. All right, so inspect your front chest. No redness, discharge, no lesions. No rashes are present. Very good. I'm gonna check your upper back. All right, no lesions, redness present as well. Very good. So I'm going to check for your respiratory rate. So breathe for me while I count your respiratory rates. Okay. Okay, very good. Your respiratory rate is 15, which is normal. There's no retractions or bulging, which is normal. So I'm going to palpate your posterior chest now. I'm going to assess your chest expansion and your tactile firmness. Okay, so any tenderness?
No.
Okay. Now I want you to say 99.
99, 99, 99, 99, 99, 99.
Okay, so there is no excessive tactile firmness, which is normal. So next what I'm going to do is I'm going to percuss your fields. I'm going to auscultate your fields. So I'm going to listen to your posterior lung sound. So I want you to just breathe normally. Take one breath. Okay. Breathe in and out. 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 In out, in out, in out, in out, in out. Okay, so your lung sounds are clear, no adventitious sounds. I'm going to percuss. Okay, so all fields are present, which is normal. Alright, so I'm going to assess for diaphragmatic excursion. So I'm going to also get in. So I'm going to palpate. So just inhale, exhale, and hold it.
Just a second, we're just recording a video. We need like 5 minutes.
Okay, inhale, hold it. Okay, so your diaphragmatic excursion is 4 centimeters, which is normal. Okay, so I'm also take your anterior chest out. Inhale. 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 Okay, lung sounds clear. No adventitious sounds are apparent. So next I'm going to perform a whispered hectorrhythmy test. Okay, so what I want you to do is I want you to say 1, 2, 3. Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, very good. So I was barely able to hear that, which is normal. So I'm going to perform the Goffman test. So I want you to say E. When I tell you to say E, say E. Okay, your Goffman test, I don't hear it as A when you say E, which is normal. So what I'm going to do next, I'm going to percuss your anterior chest, and then we should be done. Okay, so your percussion, your sounds are resonant, which is normal. So that concludes our assessment. It was a pleasure to meet you today. And